Welcome to your 2026 Benefits Overview. We will get started by highlighting strategic partners you are able to access through your health plan at Portico. We're going to review the health benefit options, including prescription drug coverage. Then we will talk about tax-advantaged accounts. We'll review the portal in which you complete the enrollment process and close with next steps. Your health plan gives you access to a wide variety of benefits administered by nationally recognized partners. I want to highlight a few of the partners you'll want to know about. BlueLink is the administrator for your medical and mental health benefits, meaning that BlueLink processes your claims. BlueLink is a subsidiary of Blue Cross Blue Shield. Portico's health plan members have access to the broad national Blue Cross Blue Shield network. Your benefits also include care coordinators by Quantum Health. This is a team of experts dedicated to helping you get the right care at the right time. Whenever you have a question about your health care, for example, about finding an in-network doctor, prescription drug coverage, your claims or deductibles, this is your first place to call for help. Prescription drug benefits are administered by Express Scripts. You can use a local in-network pharmacy or their mail order pharmacy. SWORD programs offer a variety of solutions for common conditions. Digital physical therapy for back or joint pain, digital pelvic health care for pelvic, bladder, and bowel conditions, mobility program to address daily aches and pains, reduce the risk of injury, and help you move more. No referral is needed to use SWORD, and there's no out-of-pocket cost to you. You and your family members aged 18 or older with ELCA primary health benefits are eligible. Now let's review your options. Before we get into the details of your options, let's review some key terms related to health plans. A claim is a request for a benefit, including reimbursement of a healthcare expense made by you or your healthcare provider to your health plan for items or services you think are covered. The deductible is the amount of covered expenses you must pay in the calendar year before the plan pays a percentage of eligible expenses. Generally, you must pay all the costs from providers up to the deductible amount before the plan begins to pay. If you have other family members on this plan, each family member must meet their own individual deductible until the total amount of deductible expenses paid by all family members meet the overall family deductible. Coinsurance is a specified percentage of eligible expenses you and the plan are required to pay after the deductible has been met. You pay a set percentage of your in-network claims, and the plan pays the remaining portion until the out-of-pocket maximum is reached. The out-of-pocket limit is the most that you could pay in a year for covered medical services and prescription drugs. If you have other family members in this plan, they must meet their own out-of-pocket limits until the overall family out-of-pocket limit has been met. Once the out-of-pocket maximum is met, the plan covers eligible costs at 100% for the remainder of the plan year. This does not include your monthly premium amounts. A copayment or copay is a fixed amount you pay for a covered healthcare service, usually when you receive that service. The amount can vary by the type of covered healthcare service. Here are the three options available to you in 2026. All Portico health coverage options provide in-network preventive care at 100% when billed as preventive care by your provider. There is no out-of-pocket expenses to you for preventive care. Preventive care includes such things as a yearly routine exam, mammogram, routine vision screening, and immunizations. As you can see on the chart on the screen, the gold and bronze each have a deductible. Your non-preventive medical expenses apply toward the deductible. You are responsible for 100% of the cost of care up to the deductible amounts. The deductible is the out-of-pocket amount you must reach before the plan starts covering a portion of the cost. Once the deductible is met, the coinsurance phase begins. You pay a set percentage, 20% for in-network claims, and the plan pays the remaining portion, 80%, until the out-of-pocket maximum is reached. The out-of-pocket maximum is the highest out-of-pocket amount you will pay. At that point, the plan covers eligible costs at 100% for the remainder of the plan year. The Essential Copay Plan, on the other hand, has a specified copayment amount dependent upon the type of service. We will see more of those details in the next slide. You may contribute pre-tax dollars into a tax-advantaged account to help pay for eligible healthcare expenses, which we will discuss a little later. We'll also discuss prescription drug coverage differences in a few minutes. Here's a deeper dive into the Essential Copay 2500 option. Here you can see that copayments range depending on the type of service you are receiving. Remember, preventive care is covered 100% and is not subject to a copayment. Let's compare the cost by benefit option for an office visit. Please note, this is not for preventive care. Preventive care appointments are covered at 100% regardless of the plan option you select. Let's say you have an allergic reaction and need to visit your primary care physician. Based on the coverage type you select, the out-of-pocket costs will vary. If you choose the gold or bronze option, you will receive a bill from your primary care physician for the contracted rate. In this simple illustrative example, the billed amount of the visit is $200. However, the allowed amount, as negotiated by Blue Cross Blue Shield, is $100. If you previously met your annual deductible, coinsurance would apply, and you would be responsible for $20 of the total $100 contracted cost. The plan would pay the remaining $80. If you had not previously met your deductible, you would pay $100, 100% of the contracted rate. If you choose the Essential Copay option, the fixed copay for an in-network primary care physician office visit would be $35. The $35 would be owed at the time of your visit. You also have another option, a text-based visit with 98.6 from anywhere at any time of day or night with a U.S.-based board-certified physician. No need to wait for your primary care physician's office to open or to get an appointment or to go to urgent care or the emergency room. For $0, you can connect with the doctor, upload photos of that allergic reaction if needed, receive a diagnosis and a prescription if necessary. A summary of your visit is then sent to your 98.6 account. Prescription drug costs are another key difference between the options. If you choose the Gold or Essential Copay, you'll pay a fixed copayment for generic drugs, or coinsurance with minimums and maximums for brand name drugs. The copayments and coinsurance you pay will count towards your out-of-pocket maximum, but not toward your deductible. If you choose the Bronze option, you'll pay 100% of the contracted cost until the deductible is met. After you meet your deductible, you will pay 20%. And then you will pay $0 for both generic and brand name drugs after meeting your combined medical, mental health, and prescription drug out-of-pocket limit. If you or a family member uses prescription drugs, you'll want to take a closer look at this information to help you choose between the options. Please note the website listed at the bottom of the screen. Select the option and input your medication to understand the cost of your drugs under those options. No matter which option you choose, you'll likely save money if you purchase a 90-day supply of drugs through the home delivery pharmacy rather than purchasing up to a 31-day supply at your local retail pharmacy. Here are your 2026 monthly contribution amounts, broken down from each of the three options according to who you will cover in your household. You will also see your per pay period contribution amounts. So those are the monthly costs in half. Your amounts will be withheld from the first 2 paychecks of each month. No amount is withheld if you have a third paycheck in the month during the year. Let's look at tax-advantaged accounts, more commonly known as health savings account or flexible spending account. With Bronze, you are eligible to contribute to a health savings account. The HSA allows you to defer pre-tax dollars to pay for current and/or future healthcare expenses. The 2026 annual limit for an individual is $4,400 and $8,750 for a family. Those age 55 or older in 2026 can contribute up to an additional $1,000. The funds are available as contributed. The election amount can be changed anytime throughout the year on my Portico website. HSA funds roll over from year to year, allowing you to save for healthcare expenses that come down the road, while hopefully building a savings to help you with healthcare premiums and expenses in retirement. The HSA funds, once contributed to your account, are yours to keep, even if you leave employment. They can be consolidated into another HSA plan if you choose. The funds are held in an interest-bearing account. You can elect to invest any portion of your balance once you have reached the $1,000 accumulation minimum. HSA funds are not taxed when used for eligible expenses, including medical costs, prescription and over-the-counter drugs, vision and dental expenses. When you retire, if you have funds remaining in your HSA account, you may continue to pay for eligible expenses income tax-free. You can also use your HSA balance to pay for certain Medicare and/or long-term care insurance premiums. Please note, taxes will be owed if you use the money for non-medical expenses. Whether you are enrolled in the ELCA health plan or waived with other valid health coverage, you can contribute pre-tax dollars through payroll deductions to pay for current eligible healthcare expenses into an FSA. With Gold and Essential Copay options, you can contribute to a health flexible spending account. Like the HSA, an FSA allows you to set aside pre-tax dollars from your paycheck, allowing you to spend that money income tax-free on qualified healthcare expenses for yourself and for your eligible family members. The annual limit for 2026 is $3,400. The election can only be changed following an IRS-approved qualifying event, such as getting married, having a baby, or adopting. An important rule to understand is the FSA is a use it or lose it account. If you do not use all the funds by the end of the plan year, the balance is forfeited. If you elect an FSA, you will have access to the full amount you elect for the plan year right away in January. This comes in handy if you have large healthcare expenses early in the year. With Bronze, you can contribute to a limited purpose health flexible spending account. These dollars are limited to reimbursements only for dental and vision expenses until the deductible amount is met. There are certain features that are the same between the HSA and the FSA, such as contributions are made pre-tax. Withdrawals are income tax-free as long as they are used on eligible medical expenses, and you'll receive a debit card from Health Equity under both options. Some important differences to highlight are the HSA can be changed throughout the year, where the FSA cannot. HSA dollars roll over from year to year if unused, where the FSA must be used or the balance is forfeited. An HSA is portable, so you can take it with you if you leave your employer. The balance is yours. With an FSA, it is not. The full FSA elected balance is available right away in January, whereas only the contributed amount is available for the HSA. Finally, per the IRS, an HSA is only available if you're enrolled in high deductible health coverage, so the HSA pairs with the Bronze plan, while the FSA pairs with Gold and Essential Copay. Regardless of which health plan option you choose, you are eligible for a dependent care FSA. You can contribute pre-tax dollars through payroll deductions to help pay for daycare that allows you or your spouse to work or look for work. The annual limit is $7,500 per household. The election can only be changed following an IRS-approved qualifying event. The dependent care FSA is a use it or lose it account. If you do not use the funds by the end of the year, the balance is forfeited. If you pay for daycare, this is a benefit you will want to consider during enrollment because it can offer significant tax savings depending on your situation. Now that you have heard about the three options and tax-advantaged accounts, you may be thinking, which one is the right choice for me? Please use the overview flyers to do a more detailed comparison between the options, talk with a Portico representative, or call Quantum Care coordinators. At a high level, with Gold, you will have the lowest deductible and lowest out-of-pocket amounts, but the highest monthly premium cost. Your prescriptions are copay, which don't go towards your deductible, but do go towards your out-of-pocket limit. It pairs with an FSA. With essential copay, you know what you will pay for office visits, chiropractor visits, etc. This is a big reason why people like copay options. Your copay amounts do not go towards your deductible, but they do go towards your out-of-pocket limit. Prescriptions are copay for generic drugs, coinsurance with minimums and maximums for brand name drugs, which don't go towards your deductible, but do go towards your out-of-pocket limit. Bronze is the high deductible health plan, which pairs with an HSA, so you receive the general tax benefits of an HSA. You could put your monthly premium savings into the HSA to use towards your deductible or to save for bigger expenses down the road or for retirement. If you don't have many healthcare costs, that higher deductible and out-of-pocket amount may be the right choice for you. You will want to understand the cost of current medications you and/or your family members are taking before selecting this option. If you and one or more family members are covered under the plan, you will need to meet the family deductible before the plan begins to pay 80% and you start to pay 20%. Portico's EAP service provider, Spring Health, is fully integrated into the health benefits, which will provide you with simplified continuum of care. You have access to 6 therapy sessions and 6 coaching sessions included at no cost each year. There is also legal and financial support, digital self-study, cognitive behavioral therapy, as well as other community and work-life resources. For several years, we've heard from many employers that EAP coverage for all employees, regardless of their health enrollment, is critical. So we offer EAP benefits to those not enrolled in health benefits through Carelon. Carelon connects you with qualified experts who will give personalized guidance and helpful advice based on your unique situation. Let's go over a few tips for help managing healthcare costs. Remember to show your Portico Health ID card at each provider or pharmacy visit. Keep your receipts and explanation of benefit documents for your record. Consider contributing to a tax-advantaged account to help you pay for eligible medical expenses and use your available resources at Quantum Health, Express Scripts, Health Equity, and on My Portico. You can waive ELCA health plan coverage if you or your eligible family members are enrolled in other valid health coverage. If you have a spouse or children who won't be covered on our plan and are covered under other valid health coverage, we suggest waiving them during annual enrollment. This allows them to join the plan mid-year if something changes and they need coverage. There is no cost to waive the ELCA health plan, but by doing so, you secure the option for anyone who currently does have other valid health coverage to enroll in the ELCA health plan outside of annual enrollment if needed. Now let's review the enrollment process. You will receive a member ID and SVC included in a letter from Portico. This is what you will need to register your account. After you are registered, you will complete your enrollment between November 17th and November 25th. This enrollment includes health and tax-advantaged accounts. My Portico is a user-friendly website designed to be your single online source of truth, with everything you need at your fingertips, an easy-to-access hub. From My Portico, you will experience a streamlined enrollment process, access single sign-on functionality to health benefit partners, and interact with a variety of wellness resources. You will click on the blue button from the homepage to make your enrollment selections. It is a user-friendly, intuitive process that steps you through the entire selection process. To enroll spouse or children, you will need birth dates, social security numbers, and a marriage date for spouse enrollment. Once you have reviewed your options, sign into My Portico during your enrollment period to submit your benefit selections for next year. You will receive your ID card the end of December. We are here to help. Portico Customer Care is happy to assist with website signing questions and annual enrollment process. Portico Care Coordinators by Quantum Health are happy to help with checking if your provider is in the network, which may save you money. Which option is the right one for you and your family? Continuation of care questions, how the plan works, and ongoing deductible, copay, and out-of-pocket questions. Thank you for reviewing your 2026 benefit options.